Hi, this is Stacy Knight Davis from Booth Library, and today I want to demonstrate for you just the rough techniques that you would use when doing some trial searching or test searching to determine what topic might work for further exploration in a systematic review. So I'm on the library's homepage. I'm going to go to Explore by Subject and then to Nursing, and I'm going to start with CINAHL and then just click Continue here. And I know that I want to do something with fall prevention with hospitalized patients, but I'm not really sure what yet. That's just kind of my generalized area of interest. So I'm going to go over to the PICO search. And we know that our patient population is going to be inpatient. And what we are looking at is fall prevention as our intervention. We don't really have a comparison or an outcome in mind yet because we're just exploring and looking to see what the options are. So I'm going to submit this with just these two terms here. And I absolutely misspelled prevention, so let's fix that. And it comes back with 1,414 results here. And what we can do just to see if any of these are systematic reviews is if you click on Advanced Search, it will take you back to the search screen with our search in place. And we can come down and say that we are interested only in metasynthesis, which is a broader term that includes systematic reviews. And run that search, and we get only one result for this particular search. So that gives us an idea that this might be something worth exploring, and we can look into it a little further to see what we might be able to do with it. So we know that we've got some options here. We can click on this one study that we did find, and we can look to see what all subject headings this has been tagged with. So we can see that this has accidental falls prevention and control as a subject heading, as well as inpatients. So let's play with these words a little bit more and just see what else we can get out of this. So if we click on prevention and control, you can see it popped up here with our subject heading. MH stands for medical subject heading, accidental falls control and prevention. And then if we want to add inpatient on here, it does give us some options. So we can choose inpatients, hospitalization, or hospitalized patients. And we can run this again. And now we have 1,600 results, so slightly more than we had in our first search. And if we're interested in seeing how many of these are randomized control trials to get an idea of what our pool might be for doing a review, assuming that we're thinking about restricting to RCTs, then if we go back to advanced search, then we can set the limit to search just the RCTs. And that is down here towards the middle of the page is the randomized control trials checkbox. And then we can come back up and click search. And we have 62 results. So this could be viable. We would still need to do a great deal more massaging and work with this to pick up even more of the words that would get at the idea of our hospitalized patient group. We may also, in fact, we would definitely want to look for some additional terms to get across the idea of our accidental falls, because right now we're only using a medical heading. So we're going to be missing everything that has a keyword on it, and we're also missing everything that is so new that it hasn't had headings applied to it yet. But we can see from just a little bit of experimentation that this could be something that would be a project that we could at least pursue further without having to do additional refinement to the idea of looking at fall prevention for hospitalized patients. Now, I also want to show you how this same type of search looks in PubMed. It's a good idea to also run your search in PubMed. CINAHL will give you a good nursing perspective on the situation. PubMed will pull in from other clinical disciplines so you can get an idea of what else is happening outside of nursing. So I'm going to do our same search here for fall prevention with inpatient, and we get 967 results here. If we're interested in seeing how many of these are systematic reviews, there is a checkbox over here on the left-hand side, and it comes back with 28 of those. If we want to add in the word nursing, just so we can get a kind of a quick and dirty feel on how many of these are possibly from a nursing perspective, we can add in the word nursing, and then we can do a quick look through these and just see what we've got. So there's one here from 2021 that's looking specifically at pediatric patients, so maybe we don't necessarily want to look at pediatric for this project. We can also look through here and see what some of the other ideas that people had were looking at this. Here's another one with younger patients and focusing on mental health, patients with cancer, elderly persons, looking at a 24-hour pattern. So looking at, even though there are 9 results here for systematic reviews, that doesn't mean that this isn't a possible topic. It just means that there needs to be another spin or another lens used to examine this topic, another aspect apart from pediatric patients or the other questions that are asked here. So long as you're asking a different question than what the previous reviews have asked, you're still making a contribution to the research, and your work is helpful. In addition to just teaching yourself how to do this work, your work is going to have meaning and further the knowledge. So if you do run into a situation like this where, you know, oh goodness, there's 9 results already for fall prevention with nursing, find a different aspect of that question to look at. So don't look at pediatric patients, don't look at cancer. Find some other aspect that these 9 studies didn't look at and use that as your focus and build your research question around that. Build your inclusion and exclusion criteria off of what will add new knowledge to this group of 9 results that we see here. Of course, if you have any questions, please come talk to me. I'm happy to meet with you in my office, over Zoom, over email, whatever works best for you. So again, my name is Stacy Knight Davis, and good luck with your project.